So on Saturday, Mike Adamson, CEO of the British Red Cross, said, in his words, that the NHS was facing, quote, a humanitarian crisis.
Yes, well, it is a crisis, and it is a humanitarian crisis, because hundreds of thousands of people who used to get support from social care no longer get support as a result of the billions of pounds of cuts.
Adamson later clarified those comments by saying, "We've been called in to support the NHS and help get people home from hospital and free up much needed beds. This means deploying our team of emergency volunteers and even calling on our partner, Land Rover, to lend vehicles to transport patients and get the system moving." It may sound dramatic, the fact that the NHS is facing a humanitarian crisis, but the day before, the Acute Hospitals Trust in Worcestershire announced that it would investigate 2 deaths at the Royal Hospital in Worcestershire. 2 people died last week at the accident emergency department there. One was a woman who died of an aneurysm while waiting on a trolley. Another patient died of a heart attack, cardiac arrest, after waiting on a trolley in A&E for 35 hours. They were waiting to be tended to, they weren't. A&E diverts from the 1st of December to the 1st of January for 2016 and now obviously 2017 were up 63% on the year before. So in December 2015 running into 2016 you had 88 A&E diverts. Last month you had 143. Increase of 63%. What's an A&E divert? It's when accident emergency can't take any more people. So people that are being sent there or going there have to go elsewhere. We've got something going up by 63%, which would indicate there are big problems. Elsewhere, the Nuffield Trust reported that 50 out of 152 hospital trusts in England said they don't have the resources to cope. 1/3 of hospital trusts in England. Of those 50, 7 said they are no longer capable, as of last month, of being able to offer comprehensive care. In Essex, every single hospital has gone up to black alert in the last couple of weeks. That's the highest level of emergency in the National Health Service. But while the tabloids, while the government want to say this is business as usual, that Adamson's remarks are over the top, actually it's in keeping with top medical opinion. Just listen to the words of the chairman of the BMA Council, Mark Porter, who said, "The intervention from the Red Cross highlights the enormous pressure the NHS is facing, as conditions in hospitals across the country are reaching a dangerous level. The government should be ashamed that it's got to the point where volunteers have been necessary to ease the burden." Now, the target for being seen when you go to accident and emergency is 4 hours. 95% of people that go into A&E are meant to be seen in 4 hours or less. And when the Tories came to power, it was around 40,000 a month weren't being seen to within 4 hours. Guess what it was by January 2016? It was over 200,000. It had gone up by over 500%. And guess what? It's going to be a hell of a lot more this January. And you might say, well, Aaron, that's measuring from summer to winter. That's not fair. Look at the graph. What does the trend look like to you? It's upwards. It's been upwards for 6 years. It's not going down anytime soon. And it's not just A&E, it's cancer too. Patients are being failed there as well. There are NHS-wide targets in terms of how quickly people are treated, and they're also not being met. If you look at referral to treatment targets, this is for people that need to have treatment for simple things really, relatively simple things, cataracts, hernia, hip and knee replacements. There is a target for people to be treated within 18 weeks of a referral. And the target's 92%, so it's pretty high, okay? 18 weeks, which is a pretty long time if you need a hip or knee replacement, right? A record number of people aren't being treated within that time. And guess how big the waiting list is for things like cataract operations, knee replacements, hip replacements, hernias. These may sound very mundane, but this can be incredibly discomforting. You might not be able to work. 3.9 million people are waiting to be treated for these kinds of things. And they're not. That waiting list has never been so big. The people not treated within 18 weeks, guess what? Never been so big. And it doesn't stop there. The number of patients waiting at least 4 hours on a trolley to be admitted hit a record 51,545 last January. An almost 4-fold increase on the 13,000 who did so in the same month in 2011. So with the number of patients on trolleys waiting to be admitted, we see the same thing as we saw with any waiting times. There's a secular trend since 2010, since the Tories took power. And actually, people having to wait on trolleys to be admitted is one of the major factors why ambulance response rates have been going down too. Guess how many months the target for ambulance response rates hasn't been met? Consecutively. 20 months. 20 months ambulance response rates haven't been met. The target for them. 20 months. Major factor, like I say, is because the trolleys, there's not the turnover that there should be. So on A&E times, waiting times, people waiting in trolleys, ambulance response rates, cancer treatment, targets aren't being met. And they're increasingly not being met over time. It's getting worse. So from ambulance response rates to beds, social care, A&E waiting times, cataract operations, hip replacements, cancer treatment, you name the measure, you name the indicator, the Tories are failing. Name it. Things are getting worse. They have been getting worse since 2010, since we had a change of government, first with the coalition, now with the Conservative government. So with the NHS failing, declining on every measure you can imagine, what have been the Tory Party's priorities? Well, under Andrew Lansley, we of course had a top-down reordering that cost £3 billion, restructuring, that nobody ever asked for, £3 billion this cost. And then of course with Jeremy Hunt, his hallmark political act has been to take on junior doctors, to offer a 7-day NHS. And guess what? If you go to an A&E, it's open every day of the week. Now, what was that 7-day NHS all about? Well, if you click the link below, you can see a video I made about it. It is about privatisation and outsourcing in the NHS. That's it. And I think when you look at all these measures, you look at this crisis in the NHS, it is a humanitarian crisis. It's a manufactured crisis. It's a manufactured crisis. And you may say, Aaron, come on. You're taking it too far. I'm not taking it too far. There is an agenda to privatise the NHS. There is an agenda to delegitimise and discredit a publicly funded healthcare system in this country. Don't believe me? Well, guess what Jeremy Hunt's father used to do? That's right, he used to work in private healthcare. And guess what his cousin used to do? Her name was Virginia Bottomley. She was, by the way, the MP for South West Surrey before he was. She was also once a Secretary of State for Health under the Tories. His cousin. These things are handed down like family heirlooms in the Tory Party. Well, guess what she does now? She's called Baroness Nettleston. She sits in the House of Lords. She lobbies for private healthcare. She has a directorship for Bupa, his cousin. What do you think Jeremy's going to do when he retires, when he leaves the House of Commons? I can put money on it if you want. He'll be working as a lobbyist for private healthcare. There is an agenda here to maximise privatisation, to undermine the NHS, to undermine a public ethos of public service in the NHS. It's driven by the Tories. And what angers me even more than that, because we know what the Tories think, we know what they do, specifically around public healthcare, is the media's response. Nothing. Nothing. The papers don't really talk about it, or they're apologists for it, or they defend it. Meanwhile, the BBC, what happens on a Saturday? Theresa May, nowhere to be found. Theresa Maybe, Theresa Makewaite, that's what we should call her. Jeremy Hunt, nowhere to be found. Department of Health, well, we're not saying anything, Gov. Not even a press release on the website. So the leader of the opposition goes onto television, outside a hospital. 2 people have died. 1 question in the NHS, 2 questions in the NHS. Then we start getting from Martina Croxall, will you resign? Will you resign? He was re-elected in September. 1/3 of NHS hospital trusts can't cope. 2 people have died. Have some dignity. Have some decency. 2 people died. More people are going to die. The NHS is in trouble. Now, what I want to make clear is this. From the newspapers, to the government, to the BBC, none of them care about protecting our National Health Service. None of them. All they care about is not rocking the boat, keeping the status quo, and having that inside track with power. That's all they've ever cared about. And sadly, since 2010, that means we will lose our national healthcare system. If the next 6 years are like the last 6, it's as good as broken. I've spoken before about how Britain has suffered a lost decade since 2008. Wages down 10.4% over the last 9 years, productivity flat, GDP per capita flat, living standards for the many, not the few, not just standing still, going backwards. The story is even worse with the National Health Service. It's even worse. It's now in crisis. From living standards to housing, to education, to healthcare. Tories aren't even about maintaining the status quo. If we want to keep what we've had these last 10 years, 20 years, 30 years, the things we associate with living in a civilised, modern country, we're going to have to fight for them tooth and nail. The BBC, the papers, the government aren't our friends, and they aren't going to help us. 2 people died last week in the most unimaginable way on a trolley of a cardiac arrest and an aneurysm. That will become the norm in the NHS unless we choose together to do something about it.